The Renin-Angiotensin-Aldosterone System, or RAAS, by Ashley Conway, Becky Martin, Chelsea Walter, and Ryan Erkfitz. First, we'll start with an overview. The Renin-Angiotensin-Aldosterone System is a hormone system in the body that plays an important role in regulation of blood pressure and fluid balance within the body. Here's a diagram showing all of the steps of the system, as well as the end results. We will start with the first step of the system, the activation of renin. Renin is released by the juxtaglomerular cells of the kidney in response to hypotension, which is low blood pressure, hyponatremia, which is low sodium, and/or sympathetic stimulation. All of these factors require an increase in blood pressure. The next step in the system is conversion of angiotensinogen to angiotensin. Angiotensinogen is a circulating substrate produced by the liver. When renin is released from the kidney, it converts angiotensinogen to angiotensin 1. ACE, or angiotensin converting enzyme, converts angiotensin 1 to angiotensin 2. We will then look at the actions of angiotensin 2, which lead to the final results of the renin-angiotensin-aldosterone system. We will start with the stimulation and action of aldosterone. Aldosterone is released from the adrenal cortex in response to increased angiotensin 2 levels, increased adrenocorticotropic hormone, which is ACTH, or increased potassium levels. Once released, it acts to conserve sodium, excrete potassium, and retain water by acting on the distal tubules and collecting ducts within the nephrons of the kidney. The overall result of aldosterone is an increase in blood pressure. Now, we'll look at the stimulation and action of antidiuretic hormone, or ADH. ADH is released by the posterior pituitary upon stimulation by angiotensin 2 or increased plasma osmolality. The functions of ADH are water retention and moderate vasoconstriction. The actions of antidiuretic hormone, like aldosterone, overall cause an increase in blood pressure. Therefore, the overall effect of stimulation of the renin-angiotensin-aldosterone system is increased blood pressure. Now that we've gone over how the system works, let's talk about some common drugs that affect the RAA system. We will talk about lisinopril, losartan, and spironolactone. Lisinopril is an ACE inhibitor. ACE, as you remember, is angiotensin converting enzyme, and it converts angiotensin 1 to angiotensin 2. Therefore, an ACE inhibitor will prevent that conversion, which will in turn prevent the activation of aldosterone and antidiuretic hormone by angiotensin 2. Here's a picture of where it works in the system. By inhibiting ACE, lisinopril causes a decrease in blood pressure. Losartan is an angiotensin receptor blocker, also known as an ARB. It competitively blocks the angiotensin 2 receptors, preventing its action and therefore not allowing it to stimulate the release of aldosterone and ADH. And here is where losartan works in the system. Losartan, like lisinopril, causes a decrease in blood pressure. The last medication we are going to talk about is spironolactone. It's what's called a potassium-sparing diuretic. It competitively inhibits aldosterone receptors, preventing aldosterone's action on sodium and water retention. This causes more water and sodium to be excreted in the urine. Here's where spironolactone acts in the RAA system. Like the two previous drugs listed before it, spironolactone also acts to decrease blood pressure. So, while the renin-angiotensin-aldosterone system is increasing blood pressure, these three medications, lisinopril, losartan, and spironolactone, cause disruptions in the system to bring it back down. They work well for patients with hypertension. Thank you for listening to our medical physiology presentation on the renin-angiotensin-aldosterone system.